All right, today we're jumping into a topic that affects millions of people, but can still be really confusing: allergic reactions. We're going to break down what they are, how to spot the danger signs, and maybe most importantly, exactly what to do in an emergency. So let's kick things off with a quick question. What do things like pollen, a bee sting, or even shellfish have in common? I mean, on the surface, they seem totally unrelated, right? But for some of us, they're all potential triggers, what we call allergens, that can kickstart a pretty serious response from our immune system.
And really, that big immune response is kind of like a false alarm going off inside your body. So let's get into what's actually happening when someone has an allergic reaction.
Okay, so at its most basic level, an allergy is, well, it's a mistake. Your immune system, which is designed to be this amazing bodyguard against real threats like viruses, gets confused. It misidentifies something totally harmless as a dangerous invader and launches a full-blown attack. And that harmless substance, that's what we call an allergen. And these allergens can be just about anything. The ones we see most often are things you might run into every single day: pollens floating in the air, common foods like nuts or seafood, venom from an insect sting, certain kinds of medicine, and yep, even the dander from our furry friends.
And this is not some rare, obscure thing. Allergies are actually one of the most common chronic conditions on the entire planet, affecting kids and adults alike. So chances are, even if you don't have one, you definitely know someone who does.
So, how can you tell when a reaction is happening? This part is absolutely critical because not all reactions look the same. They can be anything from a little itch all the way to a life or death emergency. Let's really break down what you should be looking for. Okay, so on one side, you have mild or moderate symptoms. This is stuff like an itchy rash, maybe some hives, sneezing, a runny nose, or a little bit of swelling around the mouth. But on the other side, you've got severe symptoms. This is a condition called anaphylaxis, and that's when you see scary things like the throat swelling up, serious trouble breathing, dizziness, or even passing out. Knowing the difference here is everything. And here is the really dangerous part. A reaction that just starts out with a few little hives can explode into a life-threatening emergency in a matter of minutes. This is why you have to pay such close attention. Which brings us right to our first aid playbook. Knowing exactly what to do in that moment can literally change the outcome, so let's walk through the immediate steps for both mild and severe reactions. For a mild to moderate reaction, the game plan is pretty straightforward. First, stay calm and try to figure out what caused it. Then, get the person away from that allergen. A cool compress can really help with any itching or swelling. If a doctor has given the okay, an antihistamine can help calm symptoms down. But the most important job you have is to watch them like a hawk to make sure it's not getting any worse. But if you even suspect it's anaphylaxis, that severe reaction we just talked about, the playbook totally changes. This is a medical emergency, full stop. Step 1, call for help immediately. Don't wait. If they have an epinephrine auto-injector, like an EpiPen, help them use it right then and there. Have them lie down flat, loosen up any tight clothes, and if they start vomiting, roll them onto their side. Now, this next point is probably the single most important thing to remember for a severe reaction, so I really want to pause here. Do not wait around to see if things get better. Hesitating for even a minute can be a fatal mistake when someone can't breathe. You use the epinephrine and call for help at the very first sign of anaphylaxis. All right, so once the immediate crisis is over and medical professionals have taken over, the focus has to shift to long-term safety. Let's look at what comes next, both in terms of medical care and prevention. So in a hospital, they have a few key tools. Epinephrine is the undisputed champion. It's the first-line treatment for anaphylaxis because it works super fast to open up the airways and get blood pressure back to normal. Antihistamines are more of a backup player. They help with skin stuff like hives, but they can't stop the really life-threatening parts of a reaction. Then, corticosteroids might be used later on to keep inflammation down. So you might be wondering, why do people have to stay in the hospital for hours, even after they feel better? Well, it's because of something called a biphasic reaction. Think of it like an aftershock. A second wave of symptoms can hit hours later with no new exposure to the allergen at all. It's exactly why that hospital trip is completely non-negotiable. The best way to deal with a severe allergic reaction is to stop it from ever happening. And that means having a solid plan. It all comes down to working with a doctor to know your triggers and how to avoid them, creating a written action plan, always carrying a prescribed autoinjector, wearing a medical alert tag, and being incredibly careful when reading food labels.
So, what's the big takeaway here? It's that you are now prepared. You have the knowledge to recognize a reaction and, more importantly, to respond to it. The only question left is who in your life, your friend, a family member, a coworker, needs to know this too? Sharing what you've learned could truly make all the difference.